Good afternoon and welcome to our Empowering Family Childcare Providers in their support of children and families during COVID-19 webinar. We want to thank you for joining us today for this very important webinar. We have quite an attendance today. Before we get started, I just want to remind you all that we are recording and that you will receive this recording in a follow-up email. We do also have handouts that are in the handout section of on the side of your screen, so you feel free to download those, but those will also come to you in a handout. If you have questions, please make sure that you use the question box to ask us any questions that you would like for us to ask. We may not get to all of them because of the large number of attendees today, but we will try to get those answers to you and send them out in a later document. So before we get started with our presenters, I do want to turn it over to our Executive Director, Dr. Lynette Fraga.
Good afternoon, everyone. Can you hear me, Kiami?
Yes.
Great. Good afternoon, everyone. Thank you so very much for joining us, particularly given the context within each of us are navigating today, the challenges that I know that our communities, our families, and each and every one of us are facing, and the amazing commitment that each of you are giving and offering as you're providing support to your own families and communities, as well as to the families and children that you care about on a daily basis in your settings, in your programs, and in your communities. So I just want to say a word of welcome. I look forward to you all engaging with us on today's webinar and also in the many additional resources that we have on our website. And I share our gratitude from Child Care Aware of America to all of you for the work that you have done, are doing, and will be doing on behalf of children and families across the country. And our thoughts are with you, and our work and our commitment is with you as well. So with that, I'll hand it back over to our organizers for today's webinar. Thank you.
Thank you, Lynette. Next slide, Colin. Today, I want to introduce to you our presenters for today. Kandi Novak from Child Care Aware of America, and Patience Hill, who is the Director of Community Engagement from Child Care Aware of America, and Marie, who is also Provider Services Manager at Child Care Aware of Eastern Kansas. So I'm going to turn it over to Kandi.
Thank you, Kiami. Welcome everyone to today's webinar. We are excited to have you here to hear about how to support family child care providers during this critical time. As you all know, family child care plays an important role in caring for our nation's children on a regular basis, but especially now in the wake of COVID-19. To help set the stage for our conversation today, here is what we already know about family child care providers. Family child care is utilized by millions of families. Family child care offers flexibility, a smaller group size, and a family environment that many families are looking for. Family child care is also a valuable resource for families, and family child care also can have some common challenges, such as a sense of isolation, limited resources, and no support staff. We also know that during the current challenges in the midst of COVID-19, that family child care providers are facing some unique challenges as well. So to help us all understand and support family child care providers better, we wanted to share some important resources and information with all of you around early brain development and how it can empower and support family child care providers in caring for children and also supporting the families today. So at the beginning of this webinar, if we could go to the next slide. At the beginning of this webinar, I'm going to be sharing a resource and some information on early brain science. And the resources that I'll be talking about are from a national initiative. It's a global initiative called VROOM. So if you haven't heard of VROOM before today, I will be sharing just a brief overview of what VROOM is and some of their resources that will help you in your outreach and support to family child care providers and families. So science is at the heart of VROOM. Leaders in neuroscience, psychology, behavioral economics, parenting, and early childhood development make up the brain trust of VROOM. And this remarkable work informs all that they do. Through research, they've learned, as you know, babies are born with tremendous potential. They're wired to learn from day one. In the moments when we connect with children, neural connections fire in the brain, taking in all those things we say and do. And while genes make up the brain's blueprint, positive, supportive experiences with adults is what helps build a child's brain and help it to grow and be strong and flexible. So that makes families and their caregivers a child's #1 brain builder. So VROOM is all about early brain science, and we'll be sharing some of the resources that they have developed that you will be able to share with your family child care providers and with families. Next slide, please. So VROOM has several resources, but they have something called VROOM Tips, which we will be sharing examples with you. And behind every VROOM tip, there's brain science. So VROOM tips are built on brain science. And both VROOM and in collaboration with Mind in the Making, they start with adults in the life of a child, and they focus on 3 core scientific principles that you see here: positive adult-child relationships, back and forth interactions, and life skills that promote executive function. So every VROOM tip are based on these 3 foundational core principles. Next slide, please. So also out of research was developed the 5 brain building basics. And as I mentioned, VROOM tips, all VROOM tips are built on these brain building basics as well. I like to say the brain building basics are the ingredients of the VROOM tips. So the brain building basics that you see on the screen: look, take turns, chat, stretch, and follow. They encourage families and caregivers to build their children's brains by making eye contact, from chatting from birth on, stretching out moments with follow-up comments or questions, and more. So these 5 actions grow a child's brain power. Next slide, please. So to give you an example of a VROOM tip, and VROOM tips are easy to use. They help us in routines and everyday moments with children. But this example of VROOM tips is called Home Museum. And on the left side of the screen in the purple, it says Home Museum, and it gives a tip of something unique that a family or a caregiver can do with a child in an everyday moment. And then on the right side is the brainy background. So it's sharing the research behind that tip and how when the tip is used with a child through an interaction, how it is beneficial to the child's brain. So VROOM tips expand on the brain building basics that you just saw on the previous slide, And there's a collection of over 1,000 vroom tips, which is really the cornerstone of the free vroom tools and resources available. The tips promote brain development from children ages 0 to 5, helping with developing language, early literacy, numeracy, and those very important executive function skills. The science behind the tips come directly from Mind in the Making and their scientific advisors. Each tip is written to be age appropriate, and it doesn't require a lot of time or any money to complete. Most importantly, the tips are meant to be fun and joyful, turning something that might be mundane or even chore-like into a positive moment of interaction. Children learn best when they're having fun. These tips are available in several different forms, including some printable PDFs that are available on the Vroom website, which is www.vroom.org. There's also a Vroom app, which delivers 1 tip a day to families or caregivers on their phone. And, although there's the Vroom app, families can also receive a tip through the Vroom by Text service, and family child care providers would be able to sign up for that as well. Tips are available in English and Spanish through the Vroom app service and the text service. Next slide, please. So in a nutshell, Vroom empowers parents and caregivers to play a proactive role in their children's early brain development by turning shared everyday moments into brain-building moments. Next slide, please. So we also wanted to share another resource with you. This is from childcareaware.org from our website, and it's specifically looking at brain building and family child care. So these checklists are available for providers on interacting with children and with engaging families. So interactions with children, those day-to-day things that family child care providers do with children to make them feel welcome, greeting them when they arrive, those back and forth conversations that are really critical, getting down on the child's level, being proactive to child's behavior, and comforting the child when needed. And these interactions with children are always important, but especially important right now. Engaging families, there's a checklist also available on our website to help family child care providers embed that brain building into the engagement of their families. So talking to families about their child's daily activities, encouraging families to visit. Once again, maybe not during these times with what's going on, but, engaging families in the future, but maybe, encouraging family engagement in other ways, maybe through some FaceTime and other types of ways, incorporating the family's culture and values, and also using technology as a communication tool to share information with families. And I think right now, technology is such a useful tool in communicating with our families and sharing information. Next slide, please. And here we just wanted to share with you an example of interacting with children and how a family child, a role of a family child care provider may use a Vroom tip. So this is a Vroom tip on hand washing, and it shares the brainy background of this interaction while hand washing. And so family child care providers can embed Vroom into their own classrooms, into their own homes, as well as engage families with Vroom. So using Vroom in a family child care home classroom is simple. It's not something extra to do, but instead it's just easily layered into the routines that they already have. Routines that are everyday, such as meal times, washing hands, diaper changing, nap time, circle time, story time, etc. Next slide, please. So a little bit more on engaging families through family childcare. Here are just some ideas of ways to embed brain building into their engagement. Sending home brain building tips that the family childcare provider has used. So if they're using a room tip or another type of brain building tip, they can share that with the family as of something that they've done with the child in their care. Encouraging families to download the Vroom app and use those brain building tips at home. Families, some families are at home more with their children now and might be looking for ideas of things that they can do. Other families are at work on the front lines, and they may be relying on those routines when they get home to be able to interact and do some brain building. So Vroom tips are a great fit for that. Family childcare providers can also ask families what type of routines they would like specific tips for to encourage learning. They can validate families as brain builders, and I think this is so important right now. Vroom's main message is, every parent has what it takes to be a brain builder. So really validating that message for families that they are brain builders for their children. Asking families what other support they may need. If there's some type of information or something they need help with. Asking families to share how they engage children in learning during everyday routine. So getting feedback from families as well as to what they're doing. Just to share from a childcare program in Arkansas who has used Vroom. They said that it replaces parent involvement efforts that cost money. It's easy to use, it's fun for the children, and our parents love our program more for sharing it with them. I don't know how much more I can brag about it. So we know that childcare programs and family childcare homes and families are finding it useful. All right, so I am going to turn it over to Marie, who is going to share how they are empowering family childcare providers through Vroom and also how they're supporting them through the COVID pandemic. So I'm going to turn it over to Marie. Thank you, Marie.
Hello, everyone. Thanks for inviting me to participate today. So we started implementing Vroom in December with our staff, December 2019, and started sharing it with programs later in December and January, starting in 2020. And we have some specific grant funding targeting just family childcare programs. So we found Vroom to just be a really great resource that we could share that just works with all of our quality improvement programs. So we have a year-long quality improvement program, which we call our long-term program. And participants get a pre and post class evaluation tool. They get on-site coaching, and there's 4 learning sessions that they are required to attend. And then we have a shorter term project called Learning Together, which is a little less intense. We meet with the providers about 6 times, and we provide them some curriculum materials like sensory bins and a block play area and curriculum resources, and that also involves mostly on-site coaching. There is no professional development requirements in that one. And then we have also a brand new piloted project this year called Successful Start, where we're reaching out to brand new family childcare providers that are just starting out. Some of them don't even have their license yet, up to those that are in their first year of opening up their business. And in all of these projects, we introduce Vroom pretty early, and we introduce it as 2 different things. One as a curriculum resource for them Room tips are really great to use during transitions, during meal times, when settling children down for naps. They can just be used throughout the day, but it's also a great resource to share with families. And our providers have had, a lot of success with that. Some of the feedback that we've had is, well, some of them have shared the app through their Class Dojo app, and families have, I think for the most part, almost all the families have gone ahead and downloaded the app and are using it. The feedback that they've gotten is that families like the science section and the chores section. And most recently with COVID and parents staying home more with their children, the chores section has also increased in popularity. One of the providers in our program has a parent cafe scheduled where she's going to be doing some demonstrations on using Vroom. They really like the tip cards when we bring them out. You can purchase those, or we just print them off and laminate them and put them on a key ring and take them out to the providers to give them examples right in their hands so they can see what a tip is, and some ideas of how they can use it right then. Parents also say they use it in the car and in waiting rooms with their children. And one way we were able to, one of our coaches, to encourage the providers to download the app, try it out themselves, and first of all, see if they like it and put it to use before sharing it with families, because it's always better if you can speak to it yourself. She just had them at a learning session and told them, go ahead and pull out your phones and let's go ahead and download that app together right here. So that worked out pretty well. What we like about Vroom is it adds the fun to what we do, whether we're doing events or reaching out to providers. Sometimes we bring information that's more health and safety focused, or especially with our brand new program, with our program for brand new providers, it's a lot of business topics and not so fun stuff. But Vroom is really fun, and it's engaging and people like it. So it's nice to be the source or one of the sources for Vroom information, because it just gives us a friendly face to both providers and families when we're out in the community. Let's go to the next slide. There we go. There might be a delay on my end. I'm very rural and my internet is a bit slow, so hang in there with me. Thought we'd just insert this slide of Kansas. Kansas is a very square state, as you can see. And I just wanted to show you where I'm located, just because when we're talking about COVID, my experiences and what our agency is experiencing right now can be very similar to what some of you are experiencing. It may be old news for some of you. It may be coming your way. And I can only really speak from my experience. So I thought I'd give you a little picture of what that looks like. If you see the little white eastern counties right there, Atchison, Leavenworth, etc., those are basically neighboring our Kansas City area where we have our high population. And that is where we started seeing our first COVID cases in the state. And as you trickle on down south along that edge, that is also where we started seeing the cases. In our state has been meeting through phone calls weekly, and a week and a half ago, those little white counties were having very different experiences than what our region was experiencing, which Region 3, where I work at, is in the gray area there. However, the county I'm located in is Douglas, so it's right next to those little white counties. And what we were experiencing in Douglas County the end of last week is what Shawnee County, which is right next to us, is experiencing this week. So we're slowly seeing a spread, and the issues that have been coming up on the eastern edge, it's good to have those conversations with those R&Rs, because we're finding out what's coming, and it's helping us to prepare to know what's going to be happening, what the issues are going to be. So let's go ahead and go to the next slide. So how we've been supporting providers during this time is we've been making phone calls. All of our staff have been reaching out to them and just checking in with them, letting them know that they're on our minds and that we support and appreciate them. I will have to say that for some staff, this goes well, and for some staff, this has been pretty stressful, because sometimes the stories that they're hearing are difficult to hear. There's a lot of stress, as you know, and difficult situations and decisions that providers are needing to make. So some caution goes with that. Make sure that people are prepared for those kind of conversations, and I wouldn't force any staff into doing those calls if they're difficult for them to manage emotionally. We have increased the number of our online class options because, you know, we've had to shut down access to people meeting in groups of 10 or more. So thankfully we were able to do that pretty quickly. So we used to typically offer one online class a month, and now we're offering them weekly, and those have been filling pretty quickly. We're also doing a couple private online classes for centers that have had to close, but they still want their staff to be able to get in some hours so they can pay them. Some of our classes in April, we are going to attempt to do them through Zoom. We have a lot of rural communities, and internet access isn't something that everybody has available to them, but we're going to try it and see. I know for some it will work, and it will be a good option for them. Another piece of the technology aspect is all of our staff are now working from home. That has been a trickle effect. A couple of our offices that happened earlier, the offices that were closer to the eastern border. And just yesterday, our main office had to break down, and everybody had to grab their files, their computers. Technology had to be rearranged. That's where our call center's at. It was a pretty big upheaval, and all those folks are working from home. And as what a lot of you have probably experienced also is the speed and capability of internet has slowed down. So things that you could easily do before sometimes are a little bit more difficult. And some of our staff are just not, they just don't have home environments that were set up and ready for home officing. So there's a lot going on staff-wise with that right now. Let's see. We are also adding Vroom resource sheets to our online classes. So what we've discovered, and we were inspired by the emergency preparedness resource sheet. I think it's called Preparing for Emergencies with Brain Building. It's a handout that I think is available to you through this webinar. We're like, wow, if you can tie Vroom tips to emergency preparedness, what can't you tie it to? And so we were looking at our online classes, and we have subjects like joyful writing and the Book Nook and other topics like that. And so we've been collecting a few Vroom tips and putting together a similar handout, just like the emergency preparedness one, that we can attach include in our online coursework. And that's pretty fun. It's nice to be able to introduce Vroom and reintroduce it and to share it and in all our different aspects. Let's go to the next slide. So another way we've been supporting providers during this time is increasing our social media output. Usually we try to be careful about how much we put out there and not flood people's phones. But now that there's a lot of isolation that's happening, and we've been discovering that there's just more activity in social media happening right now. And so we're putting out more information than we used to before. And what we love about Vroom is we can tie in Vroom tips as a way to share information that's both relevant to our providers and to the families. Our families are staying home with their children. They're trying to figure that out. Our families are trying to work from home with their children there. Providers have some of their regular enrollment, but now they've had to add school-age children because all of our schools have shut down for the rest of the year. So that's been pretty stressful for them. And so this is just an example of a Facebook post that went out addressing that we recognize and support our families and our providers during this time. And we've noticed that our engagement has increased, as well as our followers, quite a bit. And yeah, some of that we can attribute to just the COVID experience right now, because people are reaching out more through social media, I think. But I think it also has to do with our Vroom tips. People are going, wow, that's useful. I can use that information and I can apply it. And so yeah, we really enjoyed having the Vroom information. I think there's another slide that's showing a way that we've reached out. So not just Vroom tips that are, activity driven, but also social media posts about the hand washing here, as you can see, because that's a popular topic right now. Also things like posts about how to make your own wipes, because infant supplies are diminishing. How to make your own bleach solution, which we hope people know that, but sometimes this is a good time to remind folks about that. Child abuse also tends to increase when families get isolated, so we've been doing some focusing on that also. And yeah, there's just a lot of issues that are coming up for providers during this time. So I was asked to go ahead and share some of that, so we can go to the next slide. What we've been experiencing today, because every day is a new experience for us right now with COVID-19. And we have had some state directives, of course, for our child care program, saying that child care programs are considered essential, so they may stay open. Of course, many of our locations, programs have decided to shut down for various reasons. What's interesting in our conversations with family child care providers is that some of them are being asked, well, why are you still open? You should close down, when they're providing still a very valuable service to families, and families that still have to go to their jobs. And then they're also hearing the flip side, like, why are you closing? What are we going to do if you close? You can't close. Providers are being asked, can you stay open for extended hours? Because some families are having to work extended hours, depending, some family-owned businesses are true in that case. Providers are some of them are having a hard time when they know the parent is working from home and they're choosing to send their child childcare anyway. And so, you know, in our phone calls, we explain that not everybody is equipped or experienced with helping engage children in activity and then going to do, you know, the dishes or engaging them in another activity and cleaning up or maybe checking your email. Like parents are trying to do their job and they have very little experience probably in doing their job while caring for their children. And honestly, I don't know how families are doing it. It's very difficult. So if your child care is open, I can see why you'd be sending your child. The latest thing that's been happening in our area is that milk supplies are limited, as is the toilet paper, and providers start their days early before the grocery stores are opening now, because the grocery stores have limited hours now. And so the provider works a 10 or 11 or sometimes 12-hour shift. And then when they go out in the evening to purchase their supplies, which often is milk, the stores will be out of milk. And if they do land on a day when there is milk there, they have a 2-gallon limit, which for our programs, especially now that they're caring for school-age children, are discovering 2 gallons doesn't last them very long. So we're helping them problem solve that, telling them, you know, you can ask your families to run to the store, and we've reached out to some of our community organizations and businesses about this particular issue that's a little more specific to childcare. Baby wipes were another thing that we're running out of. I think I mentioned that. Our newest thing is that some of our counties have stay-at-home restrictions now, and some do not. And some counties will list the stay-at-home restrictions in a more general term. And they may say what our Kansas Health Department, KDHE, has said, which is that childcare is considered essential. So childcare programs can stay open. But some of our counties are saying you can stay open, but only if you are caring for children whose families are considered essential workers. And there's just a lot of confusion because it's not the same from county to county. The wording is never all that easy to read and understand. And so that's one of the tasks I've been working on today, as well as some of our other staff members, is finding out of the 33 counties we serve, what's in place today, what are the requirements, what are the restrictions, and verifying that and getting that information out to our providers. So their friend in one town that can be in a different county can have a very different restriction than they do, and they're only 10 minutes away from each other. So it's kind of tricky. So I think that about covers what's going on now for us and ways that we've been supporting families. I don't know if we're going to have questions at the end, but I think what I'll do is I'll pass this back over to Patience, I think is next, and I'll stick around.
Thank you so much, Marie, for sharing your experiences and what's going on in your state and what your agency is dealing with. Now we're going to transition to discuss more in detail about the free resources that have been mentioned from Kandi and Marie. So if we could go to the next slide, please. So Vroom has the brain building tips, as Kandi mentioned, and they are available to download as PDFs on the website, vroom.org, and they're also available through an app. And so again, these are all free resources that are available to share with family childcare providers. When you go to vroom.org, you will look for the professionals section, and under that tab, there'll be another tab called Tools and Resources. And when you go there, that's where you'll see all of the tips that are available to download. They are organized by age group. Some are organized by themes, such as literacy, food and play, working with others, listening, communicating. And also, some of the tips are available in different languages. So for select tips, they are available in English, Spanish, Russian, Vietnamese, Arabic, and Chinese. And in the future, there will be more languages available. So again, if you're looking for some of those languages I just mentioned, they can be accessed on Vroom.org site under the Professionals tab under Tools and Resources. Now, all the tips are not available in those languages, but that's how you can find those select tips there. You can also access the Vroom tips through the app, where there are over 1,000 tips available. The app can be accessed through a smartphone, through a tablet, online, through a computer on vroom.org. Also, if you have an Alexa-enabled device, such as an Amazon Echo, you can add the Vroom skill there and get Vroom tips. And if someone doesn't have a smartphone, they can sign up for tips through text. You can sign up for text on vroom.org, or you can text Vroom, VROOM, to 48258. And that information is available on vroom.org. For the Vroom app, it's only available in English and Spanish right now. Some of the app categories include fun with chores, as Marie mentioned, everyday routines. There's a section called Little Scientist, Let's Focus, Little Detective, Practice Patience, Let's Get Dressed. So as you can see, these are things that we do with children every day. So this is a great resource for family child care providers to share with families. All right, next slide, please. Earlier, Kandi mentioned the Brain Building Basics, and that's also a great resource to share with family child care providers around interacting with children through the brain science. And you can access a video about the Brain Building Basics on youtube.com/joinvroom. You can also access the video through the vroom.org website. So both the handout and the video are available online, and this is a great resource that you can share out with family child care providers even now, if you are able to communicate with them through email or social media. And another note is that this resource and the video are both available in English and Spanish. If we could go to the next slide, please. This resource here, called Preparing for Emergencies, is a resource that you can share with family child care providers that they can then share with families. As Marie had mentioned, it focuses on 3 phases of emergency preparedness. We have preparedness, response, and recovery. And there are brain building tips paired with each of these phases. And so this is a resource that doesn't have to be shared during an emergency, but it can be shared at any time, just to help families prepare. This is also a part of your handouts that we have in the presentation. If you could go to the next slide, please. Here is our latest resource for engaging families. And as we know, many families are adjusting to being at home with their children every day, as Kandi and Marie both mentioned. So we created 3 new resources that are great for family child care providers to share with families at this time. These resources, they include brain building tips for families to do with children during a typical morning, afternoon, or evening routine. So they're separated by babies, toddlers, and preschoolers. Each resource is 2 pages, as you can see in your attachment, and a great way to share them now is really through email, or if you're able to communicate it with them through social media. These are also available on childcareaware.org's website. If we could go to the next slide, please. So a great way to engage with family child care providers, and if they also are on social media, is through social media posts. So CCR&Rs are using social media, if not more now than ever, really to reach families and providers during this time, as Marie had mentioned. And so here at Child Care Aware of America, we have already created several social media posts that include brain building tips, and they are ready to share on Facebook and Twitter through our Smart Suite. So you can access all of these. You would just click on the tip you would want to share and share immediately. So we'll share a link to the Smart Suite with you following this webinar. And of course, childcareaware.org, we have our own COVID-19 hub where we have the latest updates and resources to support you all as CCR&Rs, as well as providers and families during this time. So we really encourage you to frequently check for updates on our website. All right, I'll turn it back over to you, Kiami.
Thank you so much, Kandi, Patience, and Marie. This was amazing information. We had quite the number of questions in our question and answer box. Some of them were being answered, and some I will ask out loud, pose to you all. There was a question, and I know some people are joining us by phone through webcast. So I wanted to just make sure that you were able to get this question asked about, do we have a social media? Do we have social media? And yes, we do. We have Facebook. Somebody asked, do we have a Facebook account? We do have a Facebook account. If you go to Facebook and search Child Care Aware, we will be there, and you can just like our page. There was a question for Marie. I believe you mentioned about, you mentioned something about wipes and bleach, and someone wanted to know, can you provide the information about the wipes and bleach again?
Sure. So what we had was, because providers were calling and saying we can't find wipes in the store, we said, well, you know, you can make your own as long as you can find paper towels. So then we thought, well, if one person's experiencing that, so could some others. So so we shared a video on our social media that showed how to make your own wipes. And then we thought, are people really disinfecting and sanitizing the way that we hope they are? And so we thought, let's go ahead and share some information about that. They are, that information is on our Facebook page. So Child Care Aware of Eastern Kansas. Does that answer the question?
Looks like. Thank you. I just wanted to share a comment also from Terry, who came in from the web. It says it is extremely, in capital letters, helpful to hear how other states are handling things and tips on how to support providers manage to find resources like wipes and cleaners. Would love to continue to do this and learn more about what other states are doing. So thank you, Terry. We're absolutely trying to highlight what other states are doing in all of our webinars. So thanks for that comment. I have a question for Kandi. It says, how can Vroom be shared with family child care that might have limited resources in isolated areas?
Thank you. So with limited resources and isolated areas, we know that some child care resource and referrals that are serving those rural populations, or maybe in a frontier population where there are family child care providers, they have had success in sharing room tips and brain science information through social media, knowing that many people do have phones, have smartphones, or even if they have a flip phone, receiving the tips through text is an option. If they do not have access to technology or the internet, sometimes it's bringing, when they do have the opportunity, whether they're doing a visit with the family child care provider or they're having some type of training, embedding that room into what they're already doing as an agency to reach those populations. But in talking with child care resource and referral agencies, many of the family child care providers do have some sort of access to technology. It might even be when they visit a library and use the computer there. So those are some ways that we have found to help family child cares that are more isolated at this time.
Thanks, Kandi. Someone asked the question of how much does the room cost? And the answer to that?
It is absolutely free. And that's the beautiful thing of it, because it is a global initiative through a nonprofit. Everything that they have done is free for families and caregivers to access.
Awesome, thank you. A question that came through that says, where can we go to access new resources that become available that relate to Vroom or the brain science? Patience, can you answer that?
Yes, so at Child Care of America, we do have some dedicated web pages for sharing brain building information with families and CCR&Rs as well as providers. So to look out for new resources that we have available, you can visit growyoungbrains.org. Or you can also do a search from the childcareaware.org website for Vroom.
Awesome, thank you. And you mentioned that there was a question about YouTube videos for Vroom.
Yes, so Vroom has several tips that are shown in videos with real life families doing the tips together, and they can be accessed at youtube.com/joinvroom. And you can also access those videos from the vroom.org website. It'll take you to YouTube.
Perfect, thank you so much. All right. How would family child care providers find tips for specific routines?
So there are a few different ways you can look for certain tips. One is if you go to vroom.org under the professional tab and look under tools and resources, and you see the PDFs of Vroom tips. I like to download those on my computer. So whenever I'm looking for a certain tip, I can open it up and I do a Control F find feature, and I just search keywords such as reading, outdoor, music, food, and I'm able to find different tips that way. Also through the app, the tips are organized by categories. So you can access the app online at vroom.org or through a smartphone, and then you can kind of scan through some of the categories there to find certain tips.
Thank you. And I'm going to take one last question because we are nearing our time and there are quite a bit of questions, but there was a question about whether or not Vroom is being implemented in all states.
So Vroom has several partners throughout the country. So definitely there's several different states who are implementing Vroom. I can't answer specifically what states there are, but the fun thing is anyone who finds out about Vroom is able to go online and share it. So we have found several CCR&Rs in other states that we didn't know about that have been using Vroom in their programs.
Awesome. I just want to direct you all to the handouts that are in this webinar that also are going to come to you, but if you want to download them now, they are on the side. We thank you so much for all of the questions and for your participation in this webinar, and we just hope that you will stay connected with us, visit our website, use all of the wonderful resources that we have at Child Care Way of America, as well as the Vroom site. Also, we thank our participants, Kandi, Marie, and Patience, for sharing amazing information. And if you have additional questions about Vroom, the website is to the left, vroom@usa.childcareware.org. Again, we thank you so much, and we look forward to hearing from you very soon. You have a fantastic day.